Of course, we are seeing different tau ligands coming into the field, and they all need to be tested and validated. It's exciting that we have options now. If one tau biomarker doesn't work, we have others. And we have now good CSF assays to detect those. I think one important missing component in the field is to be able to identify alpha-synuclein pathology. We don't yet have a ligand that binds to alpha-synuclein, so we can image it. We don't have robust CSF biomarkers for alpha-synuclein, so I think one of the developments in the field that we might be seeing in the future is identifying alpha-synuclein through imaging and CSF biomarkers. And having said that, there is a lot of developments in the MRI field where we're not really directly measuring pathology, but we are measuring the biomarkers that are linked to the pathology that may be relevant in terms of clinical disease syndromes, and also perhaps early changes even before we start seeing the pathology, such as what we see with the functional MRI, the resting state functional MRI studies, and also techniques such as MR spectroscopy, where we measure biochemicals in the brain, which may be changing even before we start seeing amyloid pathology on PET imaging, and also diffusion tensor imaging, which is kind of looking at the connectivity in the brain in the white matter that may get affected as well during early in the disease process.